Hello, this is Smita Kumar, and you're watching Medicircle. Today, on our healthcare startup series, we have yet another entrepreneur with us discussing about their startup, the dreams with which they started it, and where it has reached. And most important thing, how it is actually trying to disrupt the healthcare ecosystem by the offering they are giving to the customers and especially the patients who are always looking for such which might be available, but they may not be knowing. So we at Medicircle are trying to make bridge a gap, fill this gap between the consumers and the startups who are there in the healthcare so that they are aware about the disruptions and the beautiful innovations that is happening in this health tech industry. So today we have Sohit with us. He's the co-founder of DRiefcase. That's quite a cool and interesting name. DRiefcase is a Mumbai-based healthcare tech startup which digitizes the personal health records of the consumers, the patients, and also provides patients with single point and easy to use access to their medical data through a mobile app. The records are stored securely. That's very prime issue because today, I mean, even the consumers are not ignorant and they are actually the control. They want to control their data, with whom they should be sharing, what they should be sharing. So all these things are taken care of, and we'll try to know more about it from Soit. Available it is, and most importantly, when the data is available, access easily. Because suppose the patient is visiting multiple healthcare facilities, it's really difficult sometimes to carry all the files. And when the doctor asks something, and if it is not available, it's actually a hindrance in the treatment of the patient. So let's see how this problem is going to be solved through a brief case. Hi, Sohit. Welcome to Medicircle Healthcare Startup Series.
Hi, Smita. Thank you so much for having me.
So great. Let us first know what is Briefcase about and why you kept such a name.
Sure. No, as I said, thank you for having me. It's always a pleasure talking to people about Briefcase and the importance of digital medical records. So first up, Briefcase is your health ki tijori. That's the easiest way to explain it. It's a secured platform which helps you manage all your family's medical records at one place in a very easy to use manner. Uh, Colloquially, you can say it's a health locker. If I want to extend that, we are India's first PHR app, personal health records app, which has got integrated into the Ayushman Bharat digital mission. This is a mission which has recently been launched by the government of India. And I'm sure during this conversation, we'll talk a lot more about ABDM. But first up, a bit of history about how Briefcase came along. And you raised this question about the name as well. So let me try to answer those first. The basic thesis, Smita, that we started Briefcase with was that everyone takes care of their health, but not too many people take care of their health records. You know, when you talk to people, and we've spoken to hundreds of thousands of people during our journey, even the most organized people, when they talk about, having all their health records very seamlessly organized and all, what they mean is that there is a drawer at home where all their health records are neatly stacked. And the funny thing is, X-rays and MRIs are always kept under the mattress because that's the biggest space you can find for an A3 size X-ray or MRI. Yeah, but ask the same people that when they really needed access to those health records, how easy or difficult it was. And you'd be surprised that in 8 out of 10 times, either people are not able to access the records or it takes them so much time that it just unnecessarily adds to the stress. So that's the problem statement we started with. We said, your entire life is going digital. Your bank account, your stockbroker, your insurance policies, all are, on your phone. But why should medical records not follow the same journey? That was the thesis behind Briefcase. The theory behind the name was, in our minds, it was the doctor's briefcase. Along the journey, people added another name saying, "Oh, it's the digital briefcase." So that's how Briefcase came about.
That's a very important problem. I think it's going to solve. But again, a very important question here I would like to ask: like, what are the important USPs of Briefcase? Because we have other startups like Eka Care and Avia Life, whom we have, interviewed here, and we came to know about how they are digitalizing the personal health record. So these are also doing that same kind of a thing. So what are the differentiators that Briefcase is offering?
Sure. So the way we at Briefcase look at your health history is to look at it in a comprehensive manner. If I have to take my example, I am 42 years old, and there's a lot of medical history behind me, which is tagged in, as I said, in the cabinets, under the mattresses. So the biggest differentiator for Briefcase is when we talk about digitizing your health records, we take it very seriously and we do it 100%. So there are multiple ways in which you can upload your records. You can WhatsApp your report to a number and it goes in your account. You can email it. You can click a picture and upload. And here comes the biggest difference of it all. We can actually get the records picked up from your place, scanned and uploaded, or we can send a team home to your place to scan and upload the records. Now imagine for a family of four, you'll have at least 100, 150, 200 records, right? Young children, aging parents, your own records. If I were to ask you, Smita, that why don't you upload all your health records on your own? We have seen that in 99 out of 100 times, you would not do it. You don't have the time, neither the enthusiasm to upload all your health records. So it's very important to handhold the user to get her started. Going forward, a lot of your health records are going to be generated digitally. So this problem over time will start solving itself. But as it stands today, neither you nor I can wish away our medical history, as in we are at that age where we are. So that's the important differentiator as far as Briefcase and the whole health locker construct is concerned. The other bit is that this whole storage of medical records or the handling of your health history is something which is a part of our DNA. So we've actually taken it forward and contributed to the development of the Ayushman Bharat Digital Mission framework. We talk about being the first player, but the fact is that even before ABDM was launched or handed over to National Health Authority for implementation, we've been at it, designing the framework, giving our inputs based on what we've seen in our journey, so that the framework can come out in a manner which works for all the parties concerned, most importantly for the patient.
So, but again, as there are, I think Indian, the way Ayushman Bharat Digital Mission is digitalizing the records, which is actually a very, very big step by our Prime Minister. It has already crossed 10 million digitally linked health records. That is quite a big number. So, please tell us how this scheme has helped people and especially your startup Briefcase. Because when we talk about the digitalization, most of the part is there from the provider side, and if
That's
it
correct.
is automatically automated and sent as a digital file to the patient, it is more likely that the patient would be maintaining the personal health record. So, what's your take on that, and how do you feel is it is going to change the way, like the developed countries in NHS and other, they are actually they have digitalized their patient records way back. I mean, before us, we are still following it. Still, there are so many people who used to carry files, but definitely it's not going to work for a long time as everything has come to our mobile. So let us know your views on that.
No, sure. No, you rightly mentioned the Ayushman Bharat Digital Mission is a transformational framework. We actually say that this will change healthcare like nothing else has done in the last 70, 75 years of our existence. And the big difference, you mentioned NHS. I'll also add the US example to it, right? We always tend to look up to the West and say that, there are successful examples of transformation in those economies, in those geographies that can be replicated. However, the big difference between the West and India is that there's no centralized authority when it comes to your healthcare journey. What do I mean by that? If you look at UK, the NHS actually guides your healthcare journey. They tell you which doctor to go to as a GP, which specialist to go to, where to get your radiology tests done. Further west in the US, that's your healthcare insurance company, the payer as they call it. So your healthcare journey is defined by your payer, and as a result, in both these geographies, your health information is, at least there is a centralized place where you can find your health information. India is very different, right? I don't know of anyone practically goes to the same hospital for all his or her ailments across the family, right? Our family physician is outside of this network. My wife's gynac will be someone different. My cardiologist will be in another hospital. My child's pediatrician will be someone outside of that network. My dentist would be different. So in India, your healthcare journey is very fragmented. What the Ayushman Bharat Digital Mission does is it brings about digitization, but most importantly, it brings it about in an interoperable manner. So in an Indian context, this brings you all the benefits of digitization, where as I said, your health information is right now. Named 5, 6 sources. Imagine your health information is lying across 5, 6 sources, but the ABDM allows you to tag all of it to a centralized ID of yours, to a centralized Abha address, as they call it, and fetch it into an app like Briefcase. That's where the power of this framework lies. That as a patient, you have your entire health history, what we call the longitudinal health history, easily accessible on an app. And in early part of my conversation, I said that if I asked you to upload all your health information, you would never do it on your right. It's just too tedious to do it. That's the inertia that ABDM targets, and targets it beautifully. That all you need to do is create your Abha address, which you can do using an app like Briefcase, and then whenever you go to a provider, as long as your provider is linked to the ABDM framework, there's no linkage needed with Briefcase per se. It's only to the framework that the provider needs to be linked to. Just give your Abha address, tell them to link all your records to it, and immediately those records come on Brief. So this is like truly the UPI moment. It transforms healthcare. It is not bound to the traditional models that the West has seen, like how UPI has leapfrogged the other payment systems of the world. We believe that ABDM will leapfrog all the traditional digital health models that the world has seen till.
But as for the statistics, Sohit, above 95% of the medical records are still stored physically, which often get misplaced during the time of the need. More than 85% people in India do not have their medical records organized and at one place. And 80%, if you're talking about rural population, which is like 80% living in the village areas, have to travel to at least 60 kilometers for a doctor consults. Maintaining their physical health records is like out of question here. Or digitally, that also digitally. So again, there is a huge transition that is needed, but again, there is a resistance also, sometimes a lethargy also from the patient's perspective, that they are not doing the digitalization process when it is definitely useful for them, but still it is not being done. I know that you are also doing something like scan at home kind of a service, which you have initially offered to the patients, because so that it can help them digitalize their records better. So is it still on?
Absolutely. So, as I was mentioning, that's one of the USPs for us, that we are not saying that your health journey starts today, now that Ayushman Bharat has come in. We are saying your health journey starts the day you were born, or the day from which you can give us your health information, and we'll make sure that becomes a part of your longitudinal health history. You raised, a very important point, that in terms of the statistics about the physical records, about the inertia. See, we might want to uh, kind of put the blame on individuals, on you and me, to say we don't do this. The fact of the matter is that the user is a very smart cook. The user knows what works for her, what doesn't work for her. It's up to us as a player in the ecosystem to create use cases that make her life. UPI is big today because it makes payments journeys smooth. And that's what even ABDM is attempting to do, make life easy for people. And not only for people in urban centers, not only for India One, as we call it, but even for people in the rural areas. So small things like, recently there's been a pilot in a medical government medical college in Delhi, which will now be replicated across the country, where simply by scanning a QR code, you can get registered into that hospital and do not have to stand in those long queues. Right? If you ever go to a government hospital, the reception is very chaotic. There are long queues. You essentially spend anywhere between 1 to 2 hours just getting yourself registered.
Yes,
Now, thanks to the scanning of the QR code, that can come down to a matter of minutes.
definitely.
Those are the kind of use cases which will drive the usage of ABDM. And once people start seeing the benefits, the behavior change follows very, very quickly. So that's what we are also banking on. Our scan at home service was also a part of that same behavior change that we want to bring about. Because as you said, if I asked you to start, Smita, you don't start on your own. You need that nudge, you need that help to get started. And if I can come home, scan your 100, 150, 200 records, show it to you neatly stacked, indexed, easily searchable in the app. The next time around, when the three new documents come in, you are incentivized and motivated to update them yourself because you already have a history of 150 documents behind.
So, but who is like paying for it? What is the revenue model? Because as far as the consumers, if they are supposed to pay to maintain their health records, so they may not be so much inclined to do so. So, what's the revenue model?
Sure. So you're absolutely right that for a product like this, you cannot expect the customers to pay. In fact, our promise to our customers is that Briefcase, the basic Briefcase app, will remain free for life for them. So as long as they're uploading records on their own, they're retrieving records, creating their Aadhaar address, giving consents, all of that will remain free. As far as the business models are concerned, there are two parts to this business model, which is also a part of our plans going forward. One is, there are multiple players in the healthcare ecosystem who need to go and connect into the Ayushman Bharat digital mission. There are, if you look around in terms of number of doctors, there are 2 million doctors. There are 70,000 large and small hospitals who form a part of the insurance network, the Rohini network, and there are lakhs of labs. All these players have to be connected into the Ayushman Bharat digital mission frame. Currently, if you see the ABDM website, 1,000 companies are right now looking to integrate. It's just the start of the mission, and we already have 1,000 companies. These are solutions for some of these players, hospitals, labs, clinics, and so on and so forth. Only 65 have managed to get integrated so far. So there is a requirement which we have seen and what we have created of a middleware. So now Briefcase provides a middleware. It's a very thin layer API suite that potential partners can use and integrate into ABDM. Currently, the timeline for integration is 9 to 12 months. With our API suite, that it comes down to 4 to 6 weeks. So that becomes a strong monetizable model because I'm improving the go-to-market time for my partners. I am releasing their expensive tech resources, and you and I both know how expensive that could be, both in terms of time and money. So that's one area that we have focused on in the last few months, and we've started seeing tremendous response to it. Two partners are already at final stages of integration, 8 to 10 conversations in like the first 2 months of our launch. Here we are talking about 10 to 15 partners looking at using this middleware. And it's, as I said, the quality of conversations is very, very good. So this is a strong monetization model, the revenue model as we see. Over time, the other bit is coming back to the consumer side of it. There is another kind of framework or that's being launched by the government, which is called the Unified Health Interface, which is about democratizing healthcare services. That, why should you, if you want to order medicine from a platform, why should both the pharmacy and the citizen or the patient be on the same platform? They can be on different platforms and be connected. We call it the ONDC of healthcare. So that's the other place where we see ourselves playing a role. That as an end user application, Briefcase would look to connect into the UHI and provide that gateway to these citizens, to the patients, that here's all your health information. By the way, if you want to access certain health services, these are available as well. So that's the other place where, for when those services get consumed, there is a monetization model built in there as well. Mind you, it's all done in a privacy compliant manner and discretionary basis. It's left to the patient to choose the service, but if she does, there's a monetization piece built.
And what are your goals and expansion plans, especially when you're planning to scale up in other parts of India?
So for us, both the pieces that we spoke about are important anchors for our growth plans. On the B2B side, the API suite, what we call the ABDM connector, is something that we are kind of pushing very hard, taking it out to the market to various health tech players and solutions for hospitals, labs, and clinics. So that becomes an important part of our growth plan. On the B2C side, the idea is to keep enriching the Briefcase app. making it more and more meaningful and an integral part of your healthcare journey as a citizen, as a patient. So those are the two kind of focus areas for us. Right now, that's where we'll kind of dedicate our time and energy, push deep on this front, and see how it plays out.
Definitely. So it was really, really nice talking to you, Sohit. And on the ending note, would request you to share any experiences or any learnings that you've been experienced during your entrepreneurial journey, so that others entrepreneurs who are watching this video can learn something, even because it might be very, very inspiring. Suppose we are achieving what we are expecting. Sometimes it's the failures also which help us learn a lot of things. So do share some of your experience.
No, sure, sure. It's been a long journey for us. We started Briefcase in 2016, so it's been 6 years, and a lot of us tend to look at over the last 2 years and say we've done some great work on the Ayushman Bharat digital mission side. But what we forget is there was a 4 year kind of history before that where we were learning the ropes, so as to speak. I think one last message I leave for fellow entrepreneurs, young and old, is something that Richard Branson says, right? And Harsh and I hold it very close to our heart, which is if someone gives you a great opportunity and you don't know how to do it, just go ahead and say yes and then figure out how you will do it. And that's something we followed very, very closely. If something comes our way, we always, want to experiment with it, explore it. And I'd say, touch wood, till now, there's not been too many things where we would look back and say, oh, we couldn't figure it out in the end. We could figure out things once we'd committed, we'd do. So I think that's something as a message to everyone who's watching. I'll leave that as a note for them.
So thank you so much, Sohit. It was really, really cool, good talking to you and knowing more about the digitalization of our own health records. So let's take charge of it, and the way we have digitalized small, small things, groceries, banks, and so many things. So right from booking a show to everything, now it has come to mobile. So why the important healthcare records should be left behind? So definitely, it's very, very important to digitalize them, and you can keep connect with any of these startups whom we interview. You can read about them, you can get to know about their details, and trust them for them to be your healthcare partners. Thank you once again, Zoe, for joining us.
Thanks a lot, Smita.